My name is Caesar, and I'm going to be doing trach suctioning and trach change. So this is fall 2022. All right. So first, I will look at my provider order. So the patient wanted chair, date of birth 9/20. So the orders tracheostomy care on Tuesday, Thursdays, and Saturdays. Suction at bedside and suction tracheostomy as needed. All right. You also want to make sure you look at any conditions. Make sure you know the reason why they have a trach. Okay. Before doing your trach suctioning, you want to make sure you grab your supplies, look at the expiration date, all that good stuff. So then I will go into my patient's room. Hey, Miss Wanda Che. My name is Caesar, and I'm going to be your student nurse for today. All right. Can you please verify your name and date of birth by raising a thumb? All right. So his name is Wanda Che. Date of birth 9/20/19XX. Okay. She gave me a thumbs up. Any allergies that you know of? Could you just say no if you don't have any? So, as noted earlier, she has no allergies. So before suctioning your patient, you want to make sure you know why you're suctioning her. So I would see if there's any secretions, or where she's coughing, all that stuff. And so as I go in the room, I notice that she's coughing, and I could hear like hoarse crackles and noises. Put on clean gloves. You want to make sure you set her up in a high father's position. Okay. So before you start suctioning, you want to make sure that you get a set of vitals, put your patient on the pulse ox. Look at the vitals, see what they are before you start suctioning. And then you also want to make sure you look at your vacuum pump. You want to make sure it's at 100 to 120, because too much pressure could cause damage to the tissue, and not enough pressure will not be able to suction the patient good enough. So after doing all that, checking everything looks good, you also want to make sure you pre-oxygenate your patient. So before doing that, I will grab my kit for suctioning. You want to open it. Is a sterile kit, so you want to make sure you open it, don't break sterile procedures, and then you want to hyperoxygenate your patient. You want to make sure you want to do it between 5 to 6 breaths, no longer than 30 seconds, and then you want to put on clean gloves, grab your suction, connect everything, and then you start suctioning her. When you suction, you don't want to go ahead and suction as you're going in, so you want to suction, and then once you're coming out, that's when you want to push the intermittent suction out. Make sure you don't do it for more than 10 seconds, because you could damage the tissue as well. Alright, so once you're suctioning, you pay attention to the vitals, her O2 status, making sure she's not desatting, and then you don't want to do it too many times either. So then, once you're done suctioning, you want to listen to her, make sure she's all good. Make sure you don't hear anything there as well. You dispose of everything, you put it in your gloves, and you're done with that part. So now I'm going to be doing changing her trach as well. Okay. So for her trach, same thing. You set her up in a high father's position. You want to assess the trach. Look at the verify your patient, grab all your materials. Put on some dirty gloves. So get your store of water, your kit. And you also want to look at the expiration date, making sure that it's expired. Same thing for your store of water, making sure that it's expired. Right here. I always want to check. So same thing, perform hand hygiene. And then when doing the trach care, you also want to make sure you have a second set of trach just in case the whole thing pops up, because that could be an emergency. Alright, so we looked at the vitals, everything is good. She's already suctioned. We have her oxygenated before suctioning. We make sure there was no secretions left. She's comfortable. So now we're going to go ahead and change her trach. Alright, so first, let's do it. Taking this out. So when you take this out, You make sure you look at it. You want to see the color, the consistency, any odor, and then you want to make sure you remember so you can chart it. Okay. So dispose of this. Your dirty gloves. Because you'll perform hand hygiene again. Wash your hands. So let's see. So when you're doing, you want to make sure this is above your waist. Put this down a little. It's above your waist. And this is a store procedure. So everything inside is thorough. So I will go ahead and grab these gloves. Put them here. You want to grab your drape. Okay, open it. You gotta remember that none of this touches you, and the shiny part goes down. So there we go. So we got that. All right, take off my gloves. Okay. I'm doing this. You want to grab your store gloves. Sorry. There we go. That's it. Same thing. You want to make sure it doesn't touch you, making sure this is above your waist. Okay. So we'll go with this part. And if you have long sleeves, you want to make sure you roll your sleeves up. Okay. Sorry. Okay. So this is gonna be your clean hand. This is gonna be my clean hand. Make sure you keep it above your waist and away from you. Make sure it doesn't touch anything. This is gonna be your dirty hand. All right. So with this, with the clean hand, you make sure you grab this stuff. So okay. Put this cotton swabs over. You also want to make sure you never reach over your store field. So you want to grab stuff. So okay. Okay. Alright. So now with my dirty hand, I will grab my store of water as well, never reaching over the store field, but around. Pour 1, 2, 3. There you go. So now you're ready to put on your second store glove. Same thing. So doing a scoop. Okay, so now you have both your store gloves. Keep them above your waist. Alright, so now I will remove here, I'm just gonna move this for this purpose, but in real life you wouldn't touch anything. So take this out, put it in here. Alright, wait a little bit. Take it out, start cleaning. Okay. Make sure this does not go back into the sterile field. Get rid of that. All right. What's it? Now it's immersed in here. Yeah, I'm just gonna move this, okay? But, so you can see. So take this out with the gauze, pat it dry. Okay. Now that it's dry, it's good to go. Same thing. Away from your sterile field. Away. Then this is still considered your contaminated hand, so you put it back in with this. Alright. And then click back. Alright. So now you would grab some cotton swabs, put it in your other clean sterile field. Then you want to clean from the inside outward because you want to do from the dirtiest to the cleanest, and you don't want to put bacteria back into that opening. Okay, get rid of this. Grab another one. And as you're cleaning, you also want to assess the stoma. You want to look for any redness, any drainage, any signs of pressure on that. So now that's clean, we could go ahead and insert the new dressing on there. So now that that's all done, you can go ahead and get rid of all this right here. For the straps, they usually use Velcro straps nowadays. So you want to go ahead and strap one side on there first. Put it through the back, making sure you never go right over the stoma because it could crawl from your face. Like and then put it into the other one. And once you tie it, you could take the old one out. You want to make sure the 2 finger widths fit, and it's not too tight or too loose. Okay. Once you're done with that, you can go ahead and take off your gloves. Performing hygiene. And you also want to go ahead and reassess your patient. So I will go ahead and get another set of vital signs. I will put that pulse oximeter on them again, making sure everything looks good. I will talk to my patient, see if she's comfortable, whatnot. And then after doing all that, you will also want to chart. So you want to chart the amount of suction you did, how long you did it, how many times you did it. You also want to try and kind of estimate the amount of drainage that you took out, if any, what color, if there was any odor presence. You want to chart how the patient tolerated it. You also want to chart the vitals before and after doing the suctioning. If there was a decrease in her O2 stats or anything like that, or an increase in her heart rate, which usually happens because they're coughing, you're suctioning them. You also want to chart if there was any redness noticed in the trach, any swelling, any skin breakdown, any crust formation, any difficulty with it. You want to chart all this, which the procedure you did and what you used, and at the time that you did it as well. And that is it. Thank you.